and welcome back to Health and Family. Joining us now on set are two ladies, Carmen Lodge and Devine Smith. Both ladies have been diagnosed with lupus and will be sharing their journeys with us. Ladies, welcome to Health and Family.
Thank
and
you.
This is Devine Smith and Carmen Lodge. So we're going to start with you, Devine. Ms. Smith, when were you first diagnosed with lupus?
October 2007.
And what was your reaction? Give us sort of paint a picture for us.
When I first got diagnosed, I was sent to Boston because I was coughing and I was having chest pains, and they didn't know what was going on with me. And then my hair started falling out, my hands broke out. At that time, the doctors here really didn't have no idea of what lupus was. I had the butterfly patch. My skin, I was light when I was
Well, talk
younger.
to us about the butterfly patch, because not everybody may know
You had
that.
a stem down your face and then darkness on both sides of your cheeks, so it looks like a butterfly. And when that happened, I thought I had acne. And then the debriever, they sent me to Boston to do a biopsy on my lungs. And then returning back, they diagnosed me with pulmonary fibrosis of the lungs. When I came back, a doctor at the hospital who knew me said, Devine, you were lighter when we were younger. And I said, yeah, I woke up one morning, my skin was dark and my hair started falling on. She said, hold on, I'm going to test you. So when she came back, she said, I'm so sorry, you have lupus.
So you were diagnosed here in Bermuda?
Yes. And I was actually happy to find out what it was. When I said to her, thank God, she said, are you serious? But at least I knew I had a name to something that was going on with me. Pending joints, and it was just crazy.
All right, so we're going to go to Miss Lodge. You're Bermudian, Miss Lodge?
Yes, well, half Bermudian, half American.
Okay. No, the reason I mentioned that is because we were talking earlier and you said you were from California. It was one of my favorite places. Now, you also have lupus. When were you first diagnosed?
I was diagnosed in 2014, October of 2014.
So just recently?
Just recently, yes.
Oh, my goodness. What was your reaction?
Shocked, overwhelmed, because in 2013 I was diagnosed with breast cancer.
Oh, my gosh.
And I had done 16 rounds of chemotherapy. And when it got into 2014, I just couldn't figure out why my body wouldn't bounce back. I had severe joint pain, muscle pain. My face was starting to change. And went to my oncologist and just told her I'm feeling very fatigued, and
And that's one of the symptoms.
Yeah, what was going on, and she just said, I don't know, because all your other blood work for the cancer, you look good. So she looked at some labs that my GP had done while, back in January 2014, and she said to me, she said, Carmen, maybe you need to get checked and see what's going on. And gosh, January, February, March, April, May, I was just really sick until August. Between August and September, I went to one of the doctors, and they started running some tests, and he came back. I came back, sat in his office, and said, you have lupus. And when I say overwhelmed, because I haven't really had a chance to recover from, I've had a double mastectomy, and then the cancer treatment. I just didn't have a chance for my body to bounce back. So this was really, it really kind of set me back.
I hope you don't mind me telling you are a beautiful lady.
Thank you.
Really, both of you ladies are beautiful.
Maybe you grew up together.
Really?
Yes.
Oh, okay. Wow. So are you, both of you, currently on medication for lupus?
I'm not on anything.
You're not on
besides
anything?
High blood pressure medicine and...
Something other than...
Yes, I was on methotrexate for a while because of my lung problem. I can't take and I'm allergic to latex and sulfur, and those are the two main ingredients within the lupus medicine.
So I'm on medication. I take methotrexate, Plaquenil, and folic acid.
And so is this for the breast cancer as well?
No,
or
this is for the lupus.
Just for the lupus?
Yeah, just for the lupus.
So you mentioned fatigue was one of the symptoms. How have you been able to combat this?
With rest, I rest, but really trying to eat right, take my medication on time, pay attention to my body, and when I can, I try and at least get like a 20-minute, 30-minute walk in, just to, because even though I'm fatigued, if I do a little bit of walking, it's kind of strange, but it makes a difference, it makes me feel a little, it makes me,
So, Mrs. Smith, talk to us about some of the lifestyle changes you've had to make since contracting lupus.
My lifestyle changes was easy because I don't drink, I don't smoke, I don't hang out or party. But the main thing was just spending time with my grandkids. That kept me active. And then someone introduced me to a tea called moringa. I drink a cup of that in the morning, and I'm good to go for the rest of the day.
A lot of energy?
Yes.
Moringa?
Yes.
It gives you a lot of energy.
Okay.
Yeah.
So a lot of for my blood pressure and stuff, it kind of worked for that also. It leveled me out. Whereas taking the medication, I couldn't seem to hit that point where they said my pressure was stable. But when I started drinking the moringa, my pressure came to the level where it's supposed to be.
Good.
Headaches gone, that tired, queasy feeling I had. And see, another thing that lupus affects is your esophagus when you're eating. Everybody I know that's got lupus or has lupus right now has to take some sort of an acid pill in order to have your food settle. My problem is rice. So that's another thing that I had to take away from my lifestyle, because I love eating Chinese rice, but I can't do that anymore.
So what is like, I understand what you're saying, I really do. What has been the biggest misconception about people having lupus? Like when people look at you, what do they say, Miss Lodge, Mrs. Lodge?
I think when I explain to people that I have lupus, it's sometimes they look at me like a death sentence. Do you know what I mean?
Yes.
I get, especially after what I've gone through, it's like, oh wow, you've been hit with a double whammy. But I don't look at it like that. I'm learning how to deal with it. I just find that it would be nice to have more of a support than to like stereotype me like I have this illness and I'm always going to be sick, and yeah, it's
Well, that actually leads me to my next question. How
Yes.
important is it to have a support group?
It's very important.
Very
When they
important.
say happiness is the best medicine,
yeah,
it is.
yeah.
And so what has the support group done for you?
Well, to have somebody that understands what you're going through, that's not going to look at you, what?
Yeah.
Like my husband, when my hair started falling out, the first thing he wanted to do was go get me the perfect wig. He came back with this Beyonce wig laid on my back. But he's learned how to sew my wigs in and to help me. When I had my first stroke, I couldn't control my fingers, so he would learn how to put my makeup on for me. So to have that and to see my daughter's reactions when they saw him doing that, and the laughter, or when I was in the hospital and he was coming in and combing my hair and fixing, and the nurses reacting to it, it made my whole world feel good. And to have him doing that and have him beside me and not looking at me like, you can't even beat her for me.
Well, you got to keep it, girl.
You gotta believe it.
You got to keep her.
30 years, I'm not letting them go anywhere.
Okay. How many people in Bermuda have lupus, or can you give me like an estimate?
For our last survey that our president did, I think we were at 537 or 573.
Really?
But they weren't too sure on that because some people will repeat coming in for symptoms.
Right.
But I know majority of people that I know that have lupus have left the island because they said it was more comfortable being in England.
For any
The
reason?
lupus, because of the
Medical?
humidity.
Ah.
Our humidity has water, so it pulls us down. So when the summer heat comes out, we feel like we're dragging.
Yeah.
Right.
So that's where, if you notice that most people that have lupus will rather work nights or would work on the off season where nobody else would, because it's more comforting for us.
And you too, Carmen? You?
Yes, like for me to just be out in the sun, it will take all my energy. My face will swell up.
You have a beautiful face.
Oh,
you
thank
really
you,
do.
thank
you
you.
really do.
And the butterfly rash will
Yeah.
be more pronounced.
Yeah.
But it takes all my energy just to be out in the sun.
Okay, and you mentioned as soon as you saw me, Burgess, I'm glad you wore a butterfly. So, well, it just happens to be one of my favorite
yes.
jewelry things. But that's one of your
That's
Our
the
rebirth.
Yes.
A butterfly goes into a cocoon and comes out a whole new, so it's our rebirth.
and the purple also is
Enrichment.
Enrichment. It's one of my
Yes.
favorite colors, purple and the butterfly. Is there anything else you want to tell us about this illness that we should know about? Because I
Try
know
not to
someone's
be dis-
listening, and you know, as Dr. James said, that if we can help somebody, that's what it's all about.
I would say just really to pay attention to your body, pay attention to symptoms. If you're not feeling well, like Dr. James said, if you have the joint pain and you know, the fatigue and you know, these different symptoms, definitely see your doctor because it's something going on.
Right.
I could say with me, like I had difficulty getting out of the bed. I had difficulty climbing the steps, difficulty getting out of a sitting position, you know, and I just kept thinking it's my treatment that I had with the cancer,
Right.
and it wasn't. So I would just say definitely pay attention to your body and be aggressive, you know, with the doctor, you know, make sure the doctors are listening to what you have to say and yeah, it's very important,
Yeah,
very
because,
important.
sometimes they want to tell you, and you want to tell them, look,
Yeah,
I'm not
exactly.
feeling
Yeah,
well.
exactly.
I am fatigued.
Right, because
you know.
like I said, it took from me finishing chemo in 2013, from January 2014, just really being sick, to being diagnosed in October of 2014. So how many months of just almost bedridden sometimes. Yeah.
Well, unfortunately, I could talk to you girls. I know Devine from education, but I could talk to you ladies for quite a few more. But unfortunately, we have to go.
Okay.
So I want to thank you for sharing.
Thank you for the time you gave us.
Both very brave ladies and both beautiful ladies, and you're doing well. You look good. You look fantastic.
Thank you so much.
Thank you. While there is not a cure for lupus as of yet, I think we can agree that our two guests, Carmen Lodge and Devine Smith, are doing a good job in coping with this ailment. On behalf of Health and Family, we want to thank you, the ladies, and Dr. James, for sharing with us. I know that your sharing has helped someone listening in today. For further information on this topic, please call 293-5476 and ask for Dr. Kaiwan Brown, Dr. Flood, and our earlier guest, Dr. Stanley James. Thank you once again.